Hello and welcome. Welcome to the launch webinar for the new RAND Reach Center. Lene and I are going to be your moderators today. I'm Patricia Herman. I'm a senior behavioral scientist here at RAND, and I'm one of the PIs for the REACH grant and a co-director of the RAND Reach Center. Lene, would you introduce yourself?
Sure, thanks, Patricia. Good afternoon, everyone. On behalf of the National Center for Complementary and Integrative Health, we are thrilled to see so much interest in the launch of this new REACH Center. My name is Lene Mudd. I am the training officer at NCCIH. So I oversee our training and career development portfolio. And I'm pleased to join Patricia and the rest of RAND today to talk to you about this new innovative resource center.
Great. Let's start with a little bit of housekeeping. The attendees will be muted throughout the duration of the webinar. But if you have any questions that you have for the group here, put them in the Q&A. Your chat has been disabled, but put them in the Q&A and they'll be, if there's something that can be answered immediately, they'll be answered immediately. Otherwise, we'll save them for the end, for the Q&A at the end of this session. And also, I want you to know that within a week after the webinar, we'll be sending out a recording of the webinar to you so that you can have that or pass it on, and anybody who was registered will get that recording. And so can you go to the next slide? And Lene?
Yes, we have a packed agenda for our webinar today with a lot of great presentations to really give you a comprehensive overview of everything that the REACH Center can offer. So we'll begin with some opening remarks by senior staff at NCCIH, including our director, Dr. Ellen Langevin, and our Director of Extramural Research, Dr. Emmeline Edwards. And then we'll have a presentation on the foundation of the RAND Reach Center and get into details about the operations and resources that the Reach Center will offer, as well as how the RAND Reach Center is incorporating a plan for enhancing diverse perspectives as part of its work. We will then have three fantastic insights as to the benefits and opportunities for CIH research or complementary and integrative health research from current members' perspectives, and close with an overview of community perspectives from Dr. Margaret Chesney. And we will be saving time for the Q&A at the end. So with that overview, we'll go to the next slide. And before we jump into the opening remarks, I'd like to provide a brief introduction for Dr. Ellen Langevin and Dr. Emmeline Edwards. Dr. Langevin is the director of NCCIH and oversees the activities of the center while coordinating and collaborating with other institutes and centers across NIH and other federal agencies. She spearheaded the development of NCCIH's current strategic plan focused on whole person health research. Prior to joining the NIH, Dr. Langevin was the director of the Osher Center for Integrative Medicine, jointly based at Brigham and Women's Hospital and Harvard Medical School. And she was also professor in residence of medicine at Harvard Medical School. She also previously served as professor of neurological sciences at the University of Vermont Lerner College of Medicine. Dr. Langevin has been a strong advocate for developing innovative approaches to supporting clinician scientist career development. She will provide some initial remarks and will then be followed by Dr. Edwards. Dr. Emmeline Edwards is the Director of Extramural Research at NCCIH, and in that capacity, she is responsible for the development of scientific programs or areas of science that fulfill NCCIH's mission, as well as planning, implementation, and policy. Prior to joining NCCIH, Dr. Edwards served as Deputy Director of the Extramural Program at the National Institute for Neurological Disorders and Stroke at the NIH. Currently, Dr. Edwards is also chair of Women in World Neuroscience, which is an independent mentoring and networking organization with the primary mission of identifying, promoting, and implementing mentoring and networking opportunities for women neuroscientists across the world. So you can see there is a very strong emphasis on supporting training and career development across the leadership at NCCIH. And with that, I will invite Dr. Langevin to provide opening remarks. And if we can take the slides down during that. Thank you.
Well, thank you so much, Lene. It is my great pleasure to welcome you to this kickoff webinar on the groundbreaking REACH, or Research Across Complementary and Integrative Health Institutions Virtual Resource Centers. NCCIH is, I can say from the bottom of my heart, deeply committed to supporting research training and career development programs aimed at increasing the number and diversity of well-trained scientists to conduct rigorous, complementary, and integrative health research. We know that submitting successful research grant applications is not an easy thing. We also recognized there are particular challenges for clinician scientists to overcome, and in particular for clinician scientists who are working at clinical, complementary, and integrative health institutions that may have fewer research resources. In fact, in 2015, we convened an NCCIH Advisory Council working group on clinician scientist workforce development to identify needs and gaps, develop concepts for how to meet them, and formulate recommendations for NCCIH. I was part of this working group, and we specifically considered unique needs for supporting complementary and integrative health practitioners in clinician scientist careers, as well as additional challenges facing academic institutions training healthcare practitioners in the use of complementary approaches. The working group created 6 recommendations. Number 1, make improvements in existing programs if a need is identified and find new ways to leverage and optimize these programs. Number 2, to support a variety of career paths to the goal of clinician scientists, addressing specific roadblocks in each type of path. And as part of this effort, develop innovative approaches to support research training for clinicians with complementary and integrative health degrees. 3, develop programs to support the host environments. This is very important. At all types of institutions involved in research training in complementary and integrative health. This effort should include incentivizing institutions to reward teams of scientists and clinicians. Number 4, raise the visibility of complementary and integrative health in the research and clinical community at large by enhancing the profile of both complementary and integrative health trained clinician scientists and conventionally trained researchers who conduct research in this field. 5, tie NCCIH's training and career development initiatives to the center's priority areas for research funding while remaining open to potential support of new research areas as appropriate. And 6, consider ways to address challenges related to the peer review process. So, as I mentioned, this was back in 2015, and this was at the time I was actually a member of the NCCIH Scientific Advisory Council. So it's really, I am just so delighted that in the meantime, interim from 2015 until now, NCCIH has been working tirelessly to implement these recommendations through, first of all, our training and career development portfolio. We've made strides towards developing more opportunities for clinician scientists trained in complementary and integrative health practices to pursue clinically informed research careers on an individual levels. However, institutions training healthcare practitioners in the use of complementary approaches often lack these key research resources to fully support clinician scientists' careers of their faculty. This remained an important gap. So after I began as NCCIH director, we made this a priority to really address this in a way that was in large part inspired by the RAND Center that is actually ended up we're going to be giving us a portrait of the program that they so successfully proposed for funding. We intentionally designed the REACH funding opportunity to fill the gaps by first fostering partnerships with accredited academic institutions, providing clinical degrees in complementary and integrative health professions, and second, by providing a wide array of research and training resources to support clinician scientists, faculty located at these institutions. And this is what the RAND Center demonstrated that they were able to do in their prior work. The Research Virtual Resource Center is also well aligned with our NCCIH strategic priorities for workforce development to not only enhance the workforce, but also foster interdisciplinary collaborations and partnerships at individual and institutional levels. We're hoping that this type of institutional partnership will better support the development of clinical scientists that continue to work at complementary and integrative health clinical training institutions. This will ensure that research questions can be informed by the hands-on experience of clinicians, and also that research findings can in turn inform the clinical education of future practitioners. And this is why we are so excited to see the launch of the first NCCIH-funded REACH Virtual Resource Center. I'm going to turn it over to my colleague, Dr. Emily Edwards, to talk more about our specific goals for the RAND Research Center.
Thank you so much, Elaine. We are very pleased indeed to see the start of our investment in institutional partnership taking place. I just wanted to take the time to highlight 3 key features that we required for the REACH Virtual Resource Center. First, we required that all resources be available virtually. Now, as an outcome of the unfortunate pandemic, we all have learned that this is very possible to do this virtually. So because we want the whole program to be broadly accessible to faculty at institutions across the country, and we are requesting that those resources include administrative support, meaning technical aspect of the application development and submission, research support, including resources for designing and conducting clinical research, grantsmanship, conceptual grant development, mentoring and training to promote scientific career development, and team building resources to support the creation of diverse interdisciplinary teams. So in order to successfully pursue federal funded research, we realized that it is critical that clinician scientists have access to key resources in all those categories that I mentioned previously. The second point that I want to highlight is that the REACH Resource Center would have a broad applicability across the US to the US domestic complementary and integrative health clinical institution, and also partner with a range of clinical institutions, such as School of Acupuncture, chiropractic, osteopathy, naturopathy, physical therapy, and music and art therapy. Thirdly, as Dr. Mudd already mentioned, we really require that the REACH Resource Center include a plan for enhancing diverse perspective. This has been really a program that most NIH institutes are implementing for their institute. So this plan really outlines strategies that would enhance diverse perspective that we think are going to be critical for the development of the REACH Center. So we think that the team that actually is going to oversee the RAND REACH Center provide excellent expertise to address all those requirements that they will highlight in their presentation. But for NCCIH, we really feel that participation in the RAND Reach Center will really help the complementary and integrative health field grow and flourish in multiple ways. Improving the quality and the quantity of grant applications that are submitted by faculty at complementary and integrative health clinical institution, by helping in the formation of multi and interdisciplinary research partnership across partnering integrative health clinical institution, enhancing the research environment at integrative health institution, supporting a pipeline of clinician scientists that are trained in complementary and integrative health practices to pursue research careers in integrative health clinical institution. And finally, to support investigators that are pursuing clinical research that are aligned with the NCCIH strategic priorities for symptom management. So I really echo Dr. Langevin enthusiasm for this official launch of the NCCIH-funded Reach Virtual Resource Center. I am now going to turn it over to our NCCIH program directors, Dr. Lanny Mudd and Dr. Jennifer Baumgarten, who have been working closely with the members of the RAND team to support this effort in launching this program. So Lene and Jenny, take it away.
Well, thank you very much, Emmeline and Ellen, for those wonderful opening remarks. I've already introduced myself to this group. In this capacity for the RAND Reach Center, I'm going to be serving as the scientific officer, collaborating with the team to accomplish the goals of the RAND Reach Center. Jenny, do you want to introduce yourself?
Hi, good afternoon, good day, wherever everybody's coming in from. My name is Jenny, and I am the program officer for this exciting program. Nice to see you all.
Great, thank you. And Patricia, we'll hand it back to you.
Okay. In order to better introduce you to the RAND Reach Center, we'd like to start with a bit of background on how we began. Ian, would you introduce yourself and go ahead and provide some of that backstory?
Yes, I'm Ian Coulter. I'm a senior policy researcher at the RAND Corporation and have been involved in CIH research for something like 30 years, I believe. My purpose today is just to give you the backstory, which is really about why we created a center to begin with at RAND and also what the reasoning was behind it. There's three comments I'd make about the field of CIH. The one is that the amount of research that's been done in CIH over the last 20 years has just quadrupled. I mean, we have a huge body of literature now and research in that field. And then if we also look at the field, we now notice that there's quite a cadre of CIH health professionals who have now sought advanced degrees, either master's degrees or PhDs. It's not unusual now to see the combination PhD, say chiropractic or naturopath together. That's quite common now. The third thing, though, which is not so promising, I suppose, is that most of that research and those cadres are no longer located in the educational institutions of the CIH professions. That more and more they're losing them. 20 years ago, those colleges have incipient programs. They look quite promising. Several of them had NIH grants, and they were actually doing quite well. A lot of those have closed down. Some are more abundant. In one case, it was transferred out. So that conundrum, that third one, is something that Patricia and I got to thinking seriously about it. And I suppose the question we need to ask is, does it matter? Well, if you change the focus and looks at nursing or medicine, particularly medicine, it would be inconceivable to think that an educational program in medicine wouldn't have a robust research program. That's just not going to happen anywhere that I know of anyway. And the trilogy in medicine is that education is best, where care is best, and care is best where research is best. So not having that program is really quite a serious handicap to CI institutions. And the other thing that Patricia and I both knew because of our extensive experience with the CIH educational programs, they attract, both as students, as faculty, very talented individuals. And that cadre that I talked about clearly demonstrates their capacity to produce good researchers. So that's not an issue. It's not that the talent's not there. And then the second thing that we know as being reviewers for NIH is that modern research is collaborative research. You can think of the citizen scientist in astronomy as the most extreme example, when thousands of people are collecting data for astronomy. But right across the board now, it's pretty rare not to see collaborative research. And so we thought, well, a robust research program requires at least three things. You do need an infrastructure to deliver it. You actually need a critical mass of researchers to engage in it. And then last but not least, you actually need funding. So when we looked at RAND, and we stole this idea a little bit from the old minority research programs, and I was a director of one of those, about linking a center of excellence with a minority institution. But here, what we thought is, certainly we can help them with the infrastructure because they can start sharing RAND's infrastructure, and we can help them develop theirs, and they don't have to do it by themselves. The critical mass, even though individually they might not have it, collectively, they clearly have a critical mass. And if you combine with all the researchers we have in health at RAND, which is like 200 or 300 outstanding researchers, clearly we can solve that problem. The third problem, we think, with the funding, hopefully would flow from actually taking care of the first two. So that was kind of the thinking we had, right? That was the background we had. What we did initially is we produced this concept to Dr. Wasserman, who was head of the health program at RAND at that time. And he said, well, if this is about developing in-house capacity within these institutions, that's something that RAND does across the board for many situations, and then go for it. That isn't exactly what he said, but I'm not allowed to repeat exactly what he said publicly. But and then what we did was to think about, well, how would we do this? And we're very fortunate in finding two organizations who shared the same notion of the problem and the solution with us. And the first was the National Board of Chiropractic Examiners through Dr. Eust and his board. And they very generously gave RAND $1 million to create the first center. And the second one was the National Chiropractic Mutual Insurance Company that also was enthusiastic about it. And they provided us with $150,000 to do seed, preliminary seed grants in these institutions. And so that's the background. As I said, we were very excited that we managed to get it off the ground. And after 3 years, we then came and made the submission to NIH. And this is the result, is the REACH program. And I'll now let Patricia talk about what we do in the center and the structure.
Great. Margaret, if you could bring the slide back, that'd be good. Next slide. Our center is not a brick and mortar center. Where, I mean, that wouldn't serve the needs of our diverse and widely spread membership. Instead, the core of our center is a virtual collaborative platform. And this is a platform that was built with the help of an experienced website designer with a lot of input and really close communication with the center members. The first draft of this virtual collaborative platform, this members-only platform, was completed in 2021. And since then, it has been continuously improved and updated as we go along. There's hardly a month that goes by that we don't make some improvement to that website. And that website is a place where researchers can go and they can find they can search for different resources across RAND as well as across the various institutions. And we have, it's more than 100, I think it's like 120 researchers with their profiles online now so that they can all connect to each other and ask, and there's, forums to ask questions and so on. And up until getting the REACH grant, well, counting the REACH grant, we had 12 proposals submitted from the center and 7 were awarded. So we were doing pretty good and we plan to even do better. And this gives you an idea of the range of topics that we covered. We've got a couple things there on how opioid settlement funds can be used for non-pharmacological therapies and getting those more into the mainstream. There's a group working on a decision support tool for evidence-based diagnosis and treatment of low back pain. We've got a state of the science review for homeopathy, just basically getting away from all the arguments there and just saying, how can the quality of this research be improved? Jim Whedon, who's one of our members, you'll hear from here in a little bit. He has an R15 using Medicare data. And when we started off with a public health panel on the role of CIH providers in the pandemic, and a lot of work in public health has come off of that. Next slide. As I was saying, we have a very diverse and widespread membership. We started with 10 institutions, and now we have 13 institutions across 17 campuses. And so those are our members right now. Our current criteria for membership, or the criteria we used up until this point, is that an institution had to offer a doctoral degree in either chiropractic, naturopathic medicine, or acupuncture and or Chinese Asian traditional medicine, located in the US or Canada, have programmatic accreditation in that program, and they have to have documented evidence of commitment to research. These have been our criteria. We will be talking with the steering committee with NCCIH and going forward as to whether these criteria will change. But we do, in the next 5 years, have plans to bring in at least 10 more member institutions. So definitely let us know if you are interested in being on that short list. Next slide. I'd like to introduce the center staff. Ian, you've met before. I'm here. I've introduced myself, but I'd like to introduce Michelle Myers, who is one of the co-directors of the center, along with Ian and I, and she's the executive director of research and innovation at Northwestern Health Sciences University. And then we have Ryan Bradley, and he is on the Reach Center. He will be our collaboration coordinator, bringing all kinds of people together. And he is the director of research at National University of Natural Medicine. Michelle and Ryan are two examples of the talent and expertise out there at the institutions that we brought into the center staff so that they could be available to the members broadly. Nifa Malika is an associate policy researcher at RAND and will head our community-based participatory research efforts. Margaret Whitley is also an associate policy researcher at RAND, and she's been key in the building of our collaborative platform and will be involved in that going forward too. Margaret Chesney is a professor of medicine at the UCSF Osher Center and has been an advisor to the center for a couple of years now, and will be the chair of our advisory committee. Rihanna Rogers is the director of the RAND Center to Advance Racial Equity Policy, and she will be the Diverse Perspectives Enhancement Advisor for the center. And you'll hear from both of them here in just a few minutes. And then we've got Tiffany Keys and Susan Eric, who keep us all in line, which is a big job for them. So I'm going to turn this over now to Michelle and Ryan, and they're going to talk about some of the activities of the new Reach Center. Thank you.
Great. Thank you so much, Patricia. Hi, everybody. We're so glad you could join us this afternoon. So Ryan and I will be talking a bit about the specific efforts we have in play to build capacity for research within our member institutions. So Margaret, if you could advance the slide. Thank you. This image actually comes from our grant proposal, and I think does a really nice job at overlaying the specific areas of work that we're planning to undertake over the next 5 years, and also illustrating how we're building on a really solid foundation, as Ellen had pointed out earlier, of the RAND Center that we're building off of with the enhancements that we were able to accomplish through the REACH funding from NCCIH. Margaret, I think if you advance the slide, we can focus on the first bucket of activities. there we go, relative to collaborative research community. If we look at the peach row, the peach tier on the bottom, some of our foundational work relative to building community within our complementary and integrative healthcare institutions was, as has been pointed out, establishing this web-based platform so we could equitably reach all of our center members with the information that we were compiling to help support research efforts across our member institutions. So we established this web-based platform, which has been largely successful, and that we continually and iteratively update to make sure we're constantly enhancing member benefits through using this web-based platform. We also communicate with our members with a monthly newsletter. We have very regular email communications with them, and we have a pretty well-established infrastructure of center staff meetings and collaborations in place from which we can do the Reach Center enhancements relative to a collaborative research community. And importantly, especially in the early days of establishing all of our Reach Center activities, is what we call center-based participatory research. I think many of you are familiar with community-based participatory research, where you're engaging communities of interest in a research study. Well, we really want to make sure that everything we do, everything we implement through the Reach Center enhancements is done in partnership with our member institutions. So we really focus on center-based participatory research, so we have input from our center members and that they help inform the development of these enhancements every step of the way, because we really do feel like this is not top down, but it's a partnership with all of you. We also have a lot of plans to help ride alongside researchers at our member institutions or some of the clinician scientists who are interested in career development in terms of research. So we're looking at several K grants, R grants, U grants, different funding mechanisms to really build a solid infrastructure within our member institutions. We also plan to hold what we're calling concept incubator or idea incubator meetings. These will be monthly or every other week meetings that we plan to start within the next month, where we can all come together as a community, share ideas, share new funding mechanisms, explore who has a great idea that might be a good match, how we could partner across our member institutions to create collaborative research teams, and go in together for competitive grant funding. So we have a lot of things planned, and I know Ryan's going to talk in a little more detail about some of that collaboration, but high level, these are some of the enhancements relative to building our CIH research community that we'll be able to accomplish with the REACH grant funding. Our specific aim number 2 is relative to core research resources. And again, with the foundational REACH Center, or I'm sorry, RAND Center, we will be able to do a lot of this through our website. So we have the profiles of researchers from our member institutions listed with details, so we know who is doing which kind of research. We have information on all the teaching clinics from our academic institutions, thinking that this is a good source of both data and a nice place to operationalize some research studies. We have information about different funding opportunities and some basic information to help people put together proposals for research grants. There is a lot of work that we're going to be able to expand with the benefit of the REACH funding in this area. We've heard a lot from our center members that they need very specific help around the statistical part, both the design, the statistical design, and then the actual analysis for research projects. So we're developing a help desk where we can field questions from our center members relative to statistics. We're also going to do a help desk about grant administration and IRB support. So we'll be able to help our member institutional members with very specific questions on probably some of those parts of conducting research that most of us find to be the biggest challenges, and we can, staff those with a lot of expertise. So these help desk mechanisms are currently in development with our website designer. And again, importantly, they've been designed in consultation with a work group comprised of our center members, because we want to make sure we're really meeting our end users' needs. I skipped over in the bullets there, clinical informatics. We have some deep expertise at RAND because we know this is a growing area of interest in research. So we want to be able to support that as well. We're also able to make available resources and statistical support for analyzing large databases. We know that that's a commonplace for a lot of research, and one that we're seeing a lot more CIH research coming out of. So we want to make sure that we're making both the data sources available and the expertise needed to mine those data sets for really important high impact CIH research. And then also, we want to make sure that we are working across our member institutions to align methodologies and methodological quality. There are, of course, checklists and different mechanisms out there to make sure that scientists are standardizing the research that they're producing, but we want to make sure, especially within the CIH community, for the purposes of systematic reviews and other mechanisms to collate information about CIH, that we're using consistent methodology, that we're perhaps looking at a consistent set of patient-oriented outcome measures, and that we're doing things to really facilitate the use of the research that's produced through the center. Margaret, if you could advance, we'll look at the third bucket of aims here, which have to do with research training and mentorship. Before, the RAND Center was able to help facilitate reviews of proposals, grant proposals that people had. We put a few webinars on our website to help support the education around a few specific concepts in research. And we were able to grant access to members at our institutions to the Pardee RAND Graduate School courses and curriculum that they have there. But again, we're able to significantly enhance our mentorship through the Reach Center funding, including scholarships to those Pardee RAND Graduate School courses. We're also developing micro courses that we'll make available again through our virtual our website, so that all of our member institutional members can access very specific training relative to a lot of different specialty interests within the research community. Our member institutions will have access to city training if you do not already have that through your institutions. We have a great group of experts and advisors who are participating and willing to participate in mock study section reviews. This would be a really great learning opportunity for those of us who are submitting research grants and need to prepare the most competitive proposals possible. So we'll be able to set up some mock review sessions to sort of test by fire the grant proposals before they go in to NIH, say, for example, and give some expert feedback to make them as competitive as possible. And then we have a lot of opportunities coming up to build on the mentorship we've already been doing through the RAND Research Center. And I know Ryan will be touching more on that in just a moment, but looking at really building not only the mentor network for mentees among established CIH researchers, but also clinician scientists, as well as giving specific tools to help the mentors be mentor mentors to an expanding community of CIH researchers. Margaret, if you can advance here. Thank you. The very fourth specific aim is expanded partnerships. As Patricia said, we have some great member institutions who we've been keeping in touch with through lots of different virtual mechanisms, but we've always wanted to expand our footprint. And with the Reach Center, we're able to onboard more member institutions and do some targeted outreach to make sure that we are more comprehensively engaging the complementary and integrative healthcare community in our RAND Reach Center as well. Ryan, did you have any comments about this figure? Otherwise, we can advance to the next slide and you can give some more specifics.
No, Michelle, I don't have any more comments on this one. I think the next couple slides will get into some of these areas in a bit more detail. And I guess that's a good segue for me to take this over. So thanks for the opportunity to participate in this launch meeting. Thank you all for your attendance. I'm going to spend some time just talking about the core activities of the Reach Center. And I mean, this is really the substance of the Reach Center that we're excited to expand upon and continue to build upon. You can see in the center here, our core activities are focusing, as Michelle alluded to, on training, research concept incubation. This is a specific research project incubation, collaboration and mentorship. And you can tell from this figure, it was very intentionally chosen that this is both a cycle as well as these elements are very closely interconnected. Incubating research concepts in the absence of training or mentorship really isn't sustainable. Similarly, incubating research concepts in the absence of supporting and nurturing appropriate collaboration is unlikely to be successful as well. So these 4 areas, although we've discussed them as separate aims, they're clearly interrelated with each other, and therefore core areas for us to build capacity. So training, of course, we have found already that there's a need to really take a deep dive into some of the specific grant mechanisms. As many of you know, each NIH level grant mechanism is its own unique entity. It has its own unique eligibility requirements and budget and requirements for capacity and focus. And it's also a bit of a foreign language when you first, you read your first couple of NOFOs, and how do you make sense out of it? How do you determine whether it's the right fit for you, whether or not your institution might be competitive? So we'll take a deep dive into this area. Grant writing, of course, will be a key area of training. Grant writing, also an iterative process. I think many of us are continue to get better, despite having some success in the area. It's a practice, and all practices require doing it regularly, getting updated. Of course, requirements change from time to time. All of these things make grant writing, especially NIH level grant writing, a bit intimidating. And I tell trainees it's a bit like the lottery. You kind of have to play to win, right? You have to be a part of the process and decide that you're going to commit to writing a grant with, of course, the appropriate grants administration and other training resources available to you so that you're not really wasting time and effort. But this is a key area for us to support. Certainly training on individual research methods that are relevant to the health services research expertise of RAND and our center members. There's no question that fundamental methodological training is key for some of our center member individual faculty members, especially clinical faculty members who may have little to no exposure to research individual research methodologies. Professional development training, we've learned this through some of our existing training programs that professional development activities actually do require some support and nurturing. Even networking can be very intimidating for some trainees, especially if it's if they're entering a new field of research or within a new academic environment. And then, of course, formal coursework. And I think one of the amazing opportunities available through the Reach Center is access to the RAND Party Graduate School and some of the super rigorous and in-depth coursework that's offered through the Party Graduate School. So we're currently working on our pipeline and how do we select faculty members within our center membership and sort of get them in the queue, working on outlining a certificate program that would be partially consisting of Party Graduate School courses, as well as some internal coursework developed specifically within the Reach Center itself. So Michelle alluded to the next quadrant here, the research concept incubation. Of course, RAND's expertise is health services research. So this in some ways is limiting, but it's also quite expansive because obviously health services research covers a huge umbrella of different activities. And many of these activities we think are appropriate for our institutional members. And we think this because they already have active academic clinical centers. They're already practicing in the community. They're already representing really innovative models of care delivery. And I've always framed our academic clinics and the practices in the community of the complementary integrative health professionals as really a laboratory to investigate new models of care delivery. And so this will be a focus for us as well. Michelle, I think, really hit home the point about the RAND member focus of our activities. We want to make sure that we're incubating concepts, that they're bringing concepts forward for us to incubate, and then, of course, guided by NCCIH priorities and the NCCIH strategic plan. Quickly related to collaboration, I think Michelle alluded to the importance of this already, but we really, CIH research is complicated, and I think it actually gets kind of underestimated in its complexity. It's inherently multidisciplinary. It's inherently translational, at least early stage clinical interventions may be translational. And it requires collaboration, both within institutional centers, within our center membership, as well as identifying the appropriate expertise outside of our center memberships. And so that requires collaboration. We also think this is an area that will allow the entire center membership, all parties to rise, right? All ships rise when we collaborate together, when we work together. Our center membership is stronger together than as individual sort of unique institutions trying to do it all on their own. And the advantages, of course, are many in that we get to expand a wide geographic range. We get to increase the diversity of patient populations that we reach, and the diversity of the communities that we reach, as well as learn from each other about best practices and outstanding areas of expertise within our academic clinical centers. Finally, none of this works without appropriate mentorship, and we've learned that mentorship really requires individualized mentorship plans. The days of having a primary mentor and having an individual investigator work with one principal investigator, I think that those days are numbered, at least in the area of health services research and in complementary integrative health, because the range of disciplines necessary to create a robust research proposal similarly requires a range of disciplines for mentorship. One goal of ours is to actually conduct a mentor training within our center members, such that all of the member institutions are developing this mentorship capacity internally. And with that, I'll hand the baton back to Michelle for the next slide.
Great, thank you, Ryan. Well, we're really excited to undertake this work. And who are we to do the work? Well, we have a bench of some really deep expertise and experience. Our core group of scientists who are helping to lead the center have over 100 years of combined expertise doing complementary and integrative healthcare research. So we feel like we've been there, we've probably been at all these steps along our own professional journeys, which is going to help us, I think, to understand and appreciate and then meet the needs of our CIH institutional members. Just among, again, our core team, who you met earlier on the slide that Patricia reviewed, we have pretty deep experience in health services research, again, directly relevant to CIH in terms of quality measurement and improvement, health economics of healthcare, including payment, coverage, and cost of CIH therapies in the public. A lot of research around access and delivery of these services to different populations. We have experience with comparative effectiveness research. And then again, as we've said several times now, and very importantly moving forward, expertise in community-based participatory research, which we really feel like is an integral part of all CIH research moving forward. So we have deep expertise in our core team. And as part of the REACH Center funding, we were able to sequester some time of additional RAND research experts in lots of different areas, including implementation science, a few different biostatisticians, people with expertise in very specific various research study designs, and again, folks with expertise in large claims database analysis. So what we don't internally have, we're able to reach into RAND and sequester to help give some mentorship, help inform grant proposals, and help ride alongside our CIH institutional members as they conduct research in very specialized areas. And then again, as we've said a few times, we're excited to offer curriculum and courses from the RAND's Party Graduate School, because we know that additional formal training is important to do alongside the more informal mentorship that we already have planned. So we have scholarships set aside to help support the development of our institutional members. I think we're ready for the next slide, Margaret and Ryan.
Yeah, so for the sake of time, unfortunately, I'm going to have to just provide a quick overview of the core deliverables of the REACH Center. Again, highlighted here in the 4 quadrants, of course, grants and publications. I've had trainees in current postdoctoral training sessions say, hey, what should we be prepared to do when we leave the training program? And of course, the short answer to that is write grants and publish papers. And so we would be remiss if we didn't include grants and publications as amongst the core deliverables from the REACH Center. So these are some of our evaluation metrics for our center activities. We do think that some, I'll start first with grants. We do think some types of grants are more conducive to, competitiveness within our center members, specifically R15s, R25s, and R21s. I think we'll get to the R01s, and hopefully we get to the Ps and the Us. Ultimately, as maybe in the next round of funding of the REACH Center, we'll be prepared for some of those larger center grant type activities. But I think we need to be sort of realistic with the grant opportunities that are readily available to some of our center members and might be conducive to generating preliminary data. Also, we are developing an internal pilot grant program. We've already awarded 2 of these pilot grants, specifically targeting preliminary data generation for future grants. Moving to publications, we also think that, again, the RAND has its area of expertise in health services research, and we're really looking for a quick win when it comes to publications and publication productivity. So we're not going to be shy about that. We'll support publications through writing workshops, but I think focusing on publications that disseminate the results of center-funded studies and studies that are cultivated within the center membership. Secondary data analysis and existing CIH data sets. Dr. Whedon is specifically a member of our center to support these activities. Systematic reviews and scoping reviews are also an excellent way to enter the research arena, as well as to document expertise in specific areas of research. The other key deliverables are the development of trained mentors. I mentioned that providing a mentorship training to our center members is one of our key goals. As well as to identify the qualified investigators within our institutional membership, as well as within our center, that are prepared to mentor early stage investigators and help sort of cultivate them on to their own independent career development. And last but not least, we really hope to form a strengthened research network as a really core end result deliverable from our Reach Center activities. Again, we want to raise all ships, encourage them to work together to build research relationships within and beyond the Reach Center. And I think this is an area that we foster by example, as well as through dedicated activities to encourage their communication and their collaboration. So with that, I think we're ready for the next series of panelists. Thank you very much.
Hello, Rihanna, I'd like to have you step up and do your presentation now.
Sure. Hello again, everyone. My name is Rihanna Rogers, and I'm going to be speaking to you specifically about the Plan for Enhancing Diverse Perspectives, or short for PEDP. It's a really important component of the way in which this Virtual Resource Center for REACH is going to commit to looking at diversity in several ways. I'm going to broadly go over them, and then I'll go in a little bit more detail, and feel free to ask questions. So firstly, it aims to expand its members base by inviting new institutions from across North America annually, enhancing geographic and regional diversity by doing so, with a focus on partnerships that serve specifically underrepresented minorities, undergraduates, and active research departments that may or may not have the resources to support themselves. Secondly, the plan emphasizes career training and mentorship, which we just heard briefly about, especially in underrepresented populations, in specific focus on increasing research. Dr. Bradley, the collaboration coordinator, will connect mentees with experienced researchers and mentors, emphasizing their diverse backgrounds and creating opportunities not only for peer-to-peer mentorship, but for institutional mentorship across spaces and landscapes. The center will also offer trainings micro courses, which we just heard about, with a commitment to including materials that reflect a diverse experience and selecting faculty members that are from underrepresented experiences and diverse backgrounds, so that we can center equity in the way that we're learning and teaching others. Additionally, an advisory committee comprised of a variety of health professionals will guide the center's progress and future directions. The REACH Center will focus and foster diverse collaboration by encouraging interdisciplinary partnerships and inclusive practices, ensuring that there is equitable inclusion of individuals from disadvantaged backgrounds. And a lot of these things will be measured statistically and through data points throughout the 5 years of the institution under this first initial grant. Furthermore, I'm serving in the role as the Diverse Perspective Enhancement Advisor. As we mentioned earlier, I run the Center to Advance Racial Equity Policy at RAND. So I have a very broad landscape of looking at equity across the entirety of the organization, including health equity. So my expertise in the work of my center will be aligning with the REACH Center to assist in its diversity, equity, and inclusion efforts. To monitor progress, the center will document new member institutions, their resources, their contributions to diversity on an annual basis. Training and mentorship efforts, including training materials, will be documented on a quarterly basis with a focus on inclusion of underrepresented peoples. We have developed a timeline that overarchingly guides the work that we're doing around those larger buckets. So I'll just highlight those again. Addition of new members, which we're looking to expand on the 16 campuses. Just to highlight a few details, 9 of those serve undergraduates, 8 state, and 11 with minority focus. So we're trying to make that more robust over the course of the 5 years. Training and mentorship, I've mentioned to you before, we'll be collaborating with Dr. Bradley. The advisory committee will continue to look at making sure that we're expanding the way that we include and reach diverse peoples. Collaborations, including with my center, my role as this advisor, and as I mentioned to you, the timeline, which we can share with you shortly. But roughly, we have broken down by those buckets that I mentioned, what we would like to see happen on a quarterly basis from year 1 to year 5. And it's exciting to already see that with the beginning of this, we've already done quite a bit of work to get us along in those buckets in the first year.
Thank you very much, Rihanna. Okay, next we are going to move to getting some of the information from the members. 3 of our members have agreed to do some talks here, and so I'm gonna have them each introduce themselves, and we're going to start off with Jim Whedon so Jim, go.
Yeah, hi. Thanks very much for this opportunity to share a little bit about my experience and how I think the REACH Center will support our research program. Can we advance the slide, please? So here's a list of grant applications that I've made to NIH, and it's probably, the type is probably a little, font is a little small for you to read, but that's okay. The point is that there are all these applications. This is basically my NIH track record, but there are notations at the right in different colors, and you see there are only 3 that are in green. So three of the grants that I submitted over a period of 15 years were actually funded. All the others were rejected. So just advance the slide again, please. So I need some help. Right? 18 applications in 15 years, 3 awards. My experience is that this is really hard. And I was warned when I accepted this position as new research director at SCU. A colleague of mine, a very experienced and successful researcher, told me, oh, okay, so you're going to go to SCU. You know you're going to be all alone, right? And I'm like, yeah, I know, but I didn't really know. I didn't really know what that meant. Now I understand. I understand that research requires collaboration. Next slide, please. So now we have the RAND REACH Center. It's all about facilitating collaboration and networking with institutions, individuals, accessing expertise and resources, because we can't, no one CIH institution, very few anyway, have all the resources required to be really, successful in establishing and growing a robust research program. And this is the problem which the RAND REACH Center is intended to help resolve. So the REACH Center offers a virtual community, right? And the opportunity to collaborate, to not be alone, to collaborate, to develop research concepts, research methods, grants, collaborating on putting together grants, and eventually funded conduct that research collaboratively. We can access expertise that's not available at our home institutions. In my experience, but the biostatistical support is essential. We don't have a biostatistician at SCU. It requires us to collaborate with someone on the outside, and that's okay. It's worked out in a number of cases, but it's expensive. and can suck all the oxygen out of your grant through a subaward to another institution. Consultation on research design is something we always need. We always need experts, with the experience to really do a good job of reviewing our grant applications and our manuscripts, and research mentoring I'll need personally always need the research mentoring. And I've had the benefit of a number of good research mentors, and now with the Reach Center, that's so much more available. The resources include health claims data sets. This is my area of focus. But acquiring those data sets can be very expensive. The RAND Reach Center, it has health insurance claims data sets that we're going to make available to members. Electronic health records, again, all these institutions have clinics, right, with electronic health record systems, and it's just an incredible untapped resource that we can network with and collaborate on research. And of course, research training opportunities. So next slide, please. So we're not alone anymore. Thanks for your attention.
Great, thank you, Jim. And next up, we have Paul Amieux of Bastille.
Hi, everyone. Hello, everyone. My name is Paul Amieux, and I am the Administrative Director of Research at Bastille University, with campuses in Kenmore, Washington, and San Diego, California. So first, I want to thank the members of the NCCIH for taking such a strong interest in the work of the RAND Center for Collaborative Research in Complementary and Integrative Health. And I want to thank Ian Coulter and Patricia Herman very specifically for their scholarship on the unique struggle CIH institutions face in creating a culture of research at these institutions. Also in maintaining infrastructure for research, and finally in keeping trained CIH clinician researchers at CIH institutions. The RAND and now the RAND Reach Center is in many ways a lifeline to many of these institutions that have struggled on their own for quite some time. And with the new RAND Reach Center, it feels like that struggle is now a group effort rather than an individual effort. So I deeply appreciate that. I'd also like to acknowledge my potential conscious and unconscious biases in terms of my frame of reference. I spent the vast majority of my working career in active research laboratories at a large academic health center, the University of Washington School of Medicine, and have now had the great gift and the challenge of promoting research at a much smaller CIH institution, Bastille University. So that is my frame of reference. So if I could have the next slide, please. I want to first speak to some of the systemic barriers to promoting a culture of research throughout a CIH institution such as Bastille University. And first and foremost is the almost total dependence for the life of the school on tuition dollars rather than on indirects from grants or other revenue sources. When you are tuition driven, this fact very logically drives many of the higher level decisions about where dollars need to be allocated. Thus, it is student enrollment numbers and credit loads in individual CIH programs that sustain the school. Secondly, faculty at these CIH institutions carry significant teaching loads and are paid primarily as didactic and clinical instructors, with service and scholarship secondary to the primary role of teaching X number of credits that pays their salaries and funds the school as a whole. Qualitative interviews and surveys of dozens of faculty conducted by me and others over many years always reveal the same driving forces that prevent more active participation in research. A lack of paid release time to conduct research, and B, a lack of on-site mentoring and research training opportunities. Because faculty are primarily focused on and rewarded for being excellent teachers and clinical instructors, a culture of active research on campus becomes extremely challenging to establish, and it becomes almost impossible to keep trained CIH clinician researchers employed stably at these schools and doing actual funded research. So if I could have the next slide, please. So a few additional observations about the challenges to creating a culture of research on CIH campuses. Most CIH institutions often lack a strong formal collaborative relationship with a larger academic health center nearby, which would greatly enhance opportunities for training and also the quality of research conducted at most CIH institutions. Some of this, I believe, is simply due to cultural differences between these two types of institutions. CIH institutions are focused on programs and clinical professions that are not yet an integral part of conventional medicine. And indeed, far more research needs to be done to establish them as mainstream medicines. Finding ways to enhance mutually respectful connections between CIH institutions and large academic health centers would be a huge step to improving the quality and quantity of research at CIH institutions and provide much needed additional mentoring and research infrastructure that simply does not exist at these much smaller CIH schools. Related to the above statement about the cultural differences between large academic health centers and CIH institutions, it is also true that many traditional medicines that are often based in hundreds of years of apprenticeship and adherence to traditional methods have been wary of examination by modern scientific methods, where historically non-holistic, non-patient-centered, and often reductionist approaches to examining these traditional medicines has led to a breakdown in confidence in these methods to accurately evaluate these holistic medical systems. Having non-CIH clinician scientists from outside these professions who do not have a deep understanding of that particular traditional medicine and are not actual practitioners of that traditional medicine has also created problems with trust and mutual understanding. I believe this is a cultural and a community issue. The NCCIH Defining Whole Person Health Research stakeholder meeting held in October 2022, combined with the rise in community-based participatory research methodologies, I think will go a long way to accelerating research on traditional medicines that is both culturally sensitive and scientifically rigorous. So if I could have the next slide, please. I do believe that the RAND Reach Center has great potential to help create a culture of research at our CIH schools. And I do believe that a community-based participatory research strategy that engages CIH professionals from their clinical expertise, experience, expertise, and perspective, and giving those CIH clinicians a sense of ownership of their discipline and asking them the question, what do you think the direction of research should be for your profession, will be a recipe for success. But it is also very much up to the CIH institutions to meet the RAND Reach Center halfway and to innovatively create paid release time and/or stipends for selected faculty and residents from various CIH programs to receive formal training in research methods and work actively on rigorous research projects. We do know that this can work, as the recent State of the Science review of homeopathy conducted at RAND and funded by the Samueli Institute clearly demonstrated. In this 6-month endeavor, an experienced scientist was paired with a licensed homeopathic practitioner, creating 4 pairs of reviewers across 4 different CIH institutions and guided by expert scientist mentors at RAND with years of experience in performing systematic reviews using the latest methodologies. Weekly hour-long meetings provided a robust training ground and mentoring opportunity to ask literally hundreds of questions and drill down on the scientific theory and practice. I believe the State of the Science in Homeopathy review represents a perfect model system and laboratory for how things might be done to expand research collaboratively across institutions and to build new research relationships. But all of this still depends on the strength of our relationships within the RAND Reach Center. And we need to make every effort to strengthen these connections and provide meet and greet opportunities for individuals to reach, no pun intended, out for guidance and support. With all this being said, there are some incredibly talented faculty and students working at these CIH institutions, often with backgrounds in quantitative sciences. What we need is a new and innovative strategy to train these faculty in modern whole person research methodologies, get them publishing in collaboration with other CIH clinician researchers, and ultimately get them funding to conduct research at these CIH institutions and make sure they are incentivized to remain at these CIH institutions. So if I get the last slide, please. So this represents my hope for the RAND Reach Center and also reveals my prior years of training in enzymology. Thank you all for your time and for attending this event.
Great, thank you, Paul. Next slide, and then Brian Anderson.
All right, hello everyone. Thank you for the opportunity to speak during this event today. And I just wanted to provide a few comments on some resources that the Reach Center is making available that would be most useful to new investigators like myself. So if we could go to the next slide. So first of all, my name is Brian Anderson, and I'm assistant professor at the Palmer Center for Chiropractic Research, located at Palmer College of Chiropractic in Davenport, Iowa. So Dr. Langevin sent an email out earlier today mentioning that navigating the process of applying for and winning grants can be a tall mountain to climb, especially for complementary and integrative health professionals aspiring to become clinician scientists. So I received my PhD and started working in research full-time after 15 years of clinical practice. And her message very much resonates with my experience. So this is why I'm so excited as a relatively new investigator to have access to these resources as described by previous panelists, Michelle and Ryan, offered by the Reach Center. So I'll provide some brief comments regarding the benefits of a few of these resources from the perspective of a new investigator like myself. So first of all, the Matchmaker resource is aimed to facilitate collaborations among researchers with similar interests across institutions and connect them to grant opportunities which fill gaps in expertise. The Idea Incubator resource will help develop a research community through facilitated discussions, generating new research ideas, and fine-tuning existing ones. There's a data access resource, a library. Having access to such a library for a health services researcher like myself is really a dream come true. There's the grants help desk. So having access to a professional to assist with technical aspects related to the entire life cycle of a grant proposal will really be invaluable to a new investigator. And finally, we have the mock study sessions or section, which will provide critical feedback on grant proposals and provide real world exposure to the grant review process. So the study section then will, in addition, provide strategies to address the critiques that they have identified with the applications. So in summary, the Reach Center offers comprehensive resources for new investigators to realize their potential and improve the likelihood of receiving funding to support their work. Thank you very much.
Thank you very much, Brian. And Margaret Chesney is just going to do a quick introduction of our advisory committee, and then we'll get to Q&A. Margaret?
Thank you so very much. And I'm honored to be the chair of the Reach Center's Advisory Committee, which includes highly experienced researchers who are knowledgeable in the area of CIH and communities, including those with minorities and underserved, as Rihanna Rogers described. On the next slide, we see a list of these individuals, and I'm looking at the time, and I could give you wonderful descriptions of each one of these persons, but for the sake of time and wanting to get to questions, I'm just going to say if anybody's interested in learning more about each of the members of the committee to please get in touch with me. And let's move ahead then to the next speaker.
Thank you so much, Margaret. Okay, so we are now at the Q&A section, and we've gotten some really good questions in the Q&A. And I think that our IT person is going to basically, we're going to drop the slides. Just so you know that the email address was there is randcenter@rand.com. So, I mean, not .com, .org. I'm sorry, reachcenter@rand.org. And that will be in that follow-up email too that you get with the link. Lene, are you, do you have any suggestions for the first ones? Or I'm wondering whether we should start with the whole who can be members bit.
Yeah, I was just putting to the email in the chat for everyone. So if you do have follow-up questions after the webinar, you have the email listed there. And yeah, we received several questions really relating to who can be a member and do you have to be actively engaged in NIH funding applications or awards in order to be a member. So Patricia, would you like to take that, or would you like someone from your team?
Let me talk a little bit about who can be a member. We also had a question about, can individuals be members? And basically, if you're an individual researcher and you're not at a CIH institution, if you have an affiliation with a CIH institution who is a member, you can get access to the center resources that way. So, find out who else is a member, or your original CIH institution, have them apply for membership. And that's the way individual researchers, you don't have to be sitting at the institution, but you do have to have an affiliation with the institution. As far as institutions, one of the questioners, I think, misunderstood when we say a commitment to research. You don't already have to have NIH grants in place. You just have to have a from the top commitment of that institution to research. You can be brand new researchers, that's fine, but you can become a member that way. Just contact us there at reachcenter@rand.org. And like I said, over the next 5 years, we plan to bring in 10 more institutions. Okay, anybody else want to say anything on that? Or I think that does it. Let's see.
Sure that the presidents of these institutions are in a committee, and they've got to dedicate this commitment. That we have to have it from the top, that the institution is actually committed to developing research program. They don't have to have one, but they've got to make the statement that they're committed. So we do have it from the top down.
Okay, yes, great. Let's see. What else do we have here?
I think, Patricia, relatedly, there was some talk about the type of research that RAND has expertise in, and a question around the lines of, do members have to propose like health services research in order to take advantage of the resources that the RAND Reach Center will provide?
I'll let also Ian speak to this too, but RAND does health services research. That's what we're strongest in. And so, but there are cases where the Reach Center resources will still be of use to institutions doing a broader range of research. Ian, did you want to add to that?
The only thing we do is health service research because we do policy research, but that doesn't mean you couldn't have a basic science component that's fundamental and partnered with a piece of health services research. So I've done, say, in dentistry, we do pathology in the mouth, right? Well, we're looking at how you might intervene with the minority populations to help that problem, but you still want to do the basic science stuff to figure out what is it you need to develop a program for. So we wouldn't rule it out, but it would have to be associated ultimately with leading to a piece of health services research as well. So we could do it, but we'd have to do it. But RAND doesn't tend to have too many basic sciences, we should say. So if you have them, that would be your deliverable, I think.
Great. Let's see. We do have, should I read the next one?
Sure.
Okay. So let's see. Well, there was one question too about whether or not we're going to try to create a core set of outcomes so that will be common to all clinical trials to allow for comparisons down the road. And Michelle, do you want to address that one?
Sure. I mean, I don't think we want to be prescriptive about it through the lens of the Reach Center, but we do think that there is value in coming together as a community to talk through what are core sets of outcome measures that make sense for the research that we're doing, especially with an eye towards whole health or whole person health research, that we could all be more systematically using so that our research is more easily rolled up into systematic reviews and those types of things. But again, this is another one of those another one of those projects where we want to make sure that we are crowdsourcing wherever we head with this. So this is that center-based participatory research where we really want this community's input to come up with a shared set of, maybe outcome measures, but absolutely standards and different methodological best practices to make sure that what we are producing as a CIH community meets the highest standards of research. And I don't know if anyone else from the center wants to add to that at all.
Just one note, RAND is famous for the medical outcome study, which was a study really, well, way back in the 70s, right? I can't remember, that really developed this whole thing about outcome measures. So no, we wouldn't say we're going to have a prescriptive sort of one, but within RAND, developing outcome measures is a fundamental part of what we do. So you'd have access to it, right?
I have a few comments on this, if I may. I mean, first off, obviously you're hearing some sort of real-time thinking about this question, and this isn't something that we've considered as per se. As Michelle said, it would be great to hear some more thoughts and opinions from our community members, our center members about this concept. I personally think it's a great idea. I think when we think about the research that's available within our academic clinics and our ability to scale that in some key conditions of interest, pain, for example, still the #1 reason that CIH is used by members of the public. I think in order to be able to collect preliminary data more quickly from a wide variety of CIH interventions that could then be used as preliminary data for early stage, clinical trials or effectiveness-based trials, I think it's a terrific idea. I think the common mistake is that the list of outcome measures becomes too expansive and too diffuse to be pragmatic. But I think selecting a few common core measures that are some of which are already readily implemented within common EHR tools, I think it's a great idea to pursue and get some center member opinion on.
Great, thank you. I'm seeing a lot of comments just expressing enthusiasm for the center and all the resources. And there's a specific question here from an individual who's an earlier career clinicians researcher and asking, that whether or not the RAND Reach Center would recommend, first steps in choosing grant options and developing a grant proposal. There's so many different options out there. It's confusing to know which mechanism to choose and how to scope your application. And I think this is exactly in the line of what we want the RAND Reach Center to be able to provide, and really aligns with many of the resources that Ryan described earlier. So, Ryan, I don't know if you want to add on to any of those comments, but I think this is right up the alley of the Reach Center.
I don't have much to add. I think your answer is perfect. I think this is exactly the type of need that we hope to address with the resources within the Reach Center. It does feel like a steep mountain to climb just to get started. And so that's some of that activation energy is what we're hoping to provide and hopefully reduce over time.
And I'll just add from my perspective as a program officer at NIH that, sometimes I get contacted by folks who really have no idea where to start. And it's difficult for me to provide, a full set of here are all the steps that you're going to need to take in order to write a competitive application. So I'm really so excited to be able to point folks towards the Reach Center as a place to get more in-depth advice than what NIH staff can provide in initial email contacts as well.
We have another question here about how can nonprofits engage with researchers to conduct community-based participatory research? The kind of the real high level of that, I would recommend that they basically send us some information and we'll make sure that ends up on as a resource on our website. But Nifa, did you have any comment on that?
Yeah, thanks. I really love that question. We actually, the center is putting actually a paper coming out hopefully soon, that's highlighting all the work these institutions are actually doing currently and have been doing for years, with nonprofits, with other community partners, and the way they've been able to kind of formulate a lot of these partnerships has been the partner themselves kind of reaching out to the school and saying, hey, we would like to partner together, or the school sometimes reaching out to the nonprofits themselves and kind of creating a partnership that then they can identify what are these research questions that we actually can work on together, and what are these things we could do together that then they could push forward with it. And so yes, absolutely, if there is based on our member site, if you could kind of look at what institution is closest to that particular nonprofit that you can connect to, and if you don't know who to reach out to, please reach out to us and we can try to kind of make those connections, and definitely try to figure out ways that even if it's not with that specific institution that you're closest to, maybe there's another institution that can actually work the closest with you to actually do the type of work that you want to do. So I love that question, and I'm so glad that you actually asked it. So.
Okay. Great. Well, we see another question actually that Dr. Launchman posed in the chat, really related to the full life cycle of applying to NIH and receiving funding. And we certainly see that investigators from under-resourced institutions tend to have a lower rate of resubmitting their proposal after the initial try, depending on whether or not it was scored and how good the score was. What we see is that they're not reapplying with the revised application and as much or as often. And so the question is, will there be an emphasis on helping investigators read and understand summary statements and encouraging them to resubmit in the process of resubmission as well within the RAND resources?
The quick answer is yes, but I'll let Michelle jump in on this one.
Oh, sure. Well, I think it's such an important item to raise. And I was sort of smirking, maybe Patricia, that's why you called on me, because I was thinking, I think one piece of this is being like a support system for each other. When I'm thinking back to Jim Whedon's slide, and this is every researcher's experience, and you can feel really down about the rejection rate, but it's part of the business. And so I think, first of all, having a community of peers who understand this is normal, and can be your cheerleaders to help support you along the way is one part of what this center wants to be. On the other, the other side of that coin is really helping to have mechanisms in place to encourage you to resubmit, to improve what you have, to understand what the reviewers' comments are and what changes you need to make a competitive resubmission. And that's where the mock review sessions are going to be very helpful. Before you even submit, afterwards, we'll have some trainings in place to help you understand, okay, I got comments back, or I didn't even get scored, what now? And we'll build in lots of support so that you can reconsider your application, work with experts who are going to ride alongside you to make sure that you can make the necessary changes, maybe bring on additional expertise, and then have a competitive resubmission. So I was really, really glad to see that question, Ellen, and I think it's a really important thing that the center can give to our members.
Okay, we are, let's sneak this one last question in there. And I will ask this for Lene, maybe you would know from NCCIH's point of view, any thoughts on holding an in-person conference that can bring together this resource in institutions and researchers together? And I know we are supposed to do everything virtual, but do you have any comment on that?
Sure, this is a great question. I think that we did write the funding opportunity to be completely virtual. And our motivation behind that was to provide widespread accessibility to all institutions across the United States, no matter where they were located and whether they were close to where the REACH Center was located. And that really is still our goal, is that we have this widespread accessibility. I think that this question of an in-person conference to bring partners together is a very interesting question. It's certainly something that we can consider down the line and see, especially as partnerships begin to form, with faculty across different institutions, there might be value to holding something like that in the future. So I think we'll have to just kind of wait and see on that front, and certainly encourage folks to, take advantage of these virtual resources.
Great. I think we're at time. I want to really thank everybody, for all of our audience for being here, all of our panelists for speaking, and we're very excited about moving this forward. So thank you.
Can I just say one quick
Yes.
congratulations
Yes.
to the RAND Reach Center? They really blew us away in how they proposed this really beautiful kind of concept that really, in large part, as I said, derived from their prior work, but it was so incredibly responsive to what we had in mind. It was a model of a successful grant application in and of itself. So I'm going to say you all are in good hands. The proof is in the pudding, right?
Thank
And
you.
so I
Thank
can
you,
say
Paula.
this augurs very well for the success of all of you who are going to be taking advantage of this wonderful resource.
Thank you very much, Helen. Definitely. Okay. We'll see you all around
Thank you.
in the research world. Okay. Bye. Thank you.